As we know that coronary artery disease, it's a dynamic disease where it may lead to a stable or unstable event. Recently in 2019, the ESC guidelines had changed the term, the chronic coronary syndrome, which has a 6 subsets. One is the asymptomatic patient having detected during the screening. Second is a patient with a vasospastic microvascular disease. Third is the asymptomatic patients of a more than 1 year duration of a diagnosis. I think then the fourth is in a patients with the asymptomatic patients of a symptomatic patient of a less than 1 year. Any recent onset heart failure or a stable coronary arteries. These are the clinical spectrum the ESC guideline had included in the broad spectrum term of a chronic coronary syndrome. These are the biomarkers for the inflammation that we will discuss. But as we know, there are the 100% hypothesis that in a transplant-associated atherosclerosis, immunological mechanism is active, whereas in familial hypercholesteremia, the lipoproteins are active. And there are gray zone, which is overlapping between the two mechanisms. And as we know that atherosclerosis is a serious threat for the human life. And still we have, in spite of, we know that risk factors may contribute, but in spite of having a low risk profile, the patient present with the CAD, or in spite of doing adequate revascularizations, patient had persistent signs of ischemia. So there is a link between the inflammation, thrombosis and coronary syndrome, either ACS or CCS. So we need to, and there almost, it took more than 20 years of the literature and the study that they found there is a link of inflammations in the patient with the atherosclerosis. And the inflammatory response is provoked by the ischemic or a dead myocardium, or it could be a cerebral or anywhere else. And that is because that lipid-laden macrophage, they attract the leukocytes, and there is a release of cytokines, and the vascular smooth muscle proliferations and whole milieu start. So the targets are 4 in a patients with the chronic coronary syndrome. The platelets in the form of antiplatelets, the anti-thrombotic therapy, lipid lowering, but there is a role of controlling the inflammations. And these are the various, beautifully given, the various mechanisms of actions of the anti-inflammatory agent. In patients with a CAD, the colchicine, those who are acting on the IL-6 receptor antagonist, the tocilizumab, and the IL-1 beta inhibitor, the canakinumab, has been well established to reduce the inflammations in a patient with a CAD. So there is a subclinical low-grade inflammations has been established, and which increases the risk of MACE. And obviously the low-dose aspirin, I think in Jupiter they had taken a subset of a patient with the HSCRP level. These are HSCRP, HS troponin, anti-pro-BNP. These are the biomarkers for studying the inflammations. So there is a role of statin has been established that also act as an anti-inflammatory effect. Now, what are the major trials has been published? I would like to discuss the 4 major trials. One is a CANTOS trial, which taken account of, it is a double randomized trial and published in NEJM in 2017. It is taken almost 10,000 patients, and 3 doses were studied, the 50, 150 and 300 milligram. But they found 150 milligram dose was very good, and there is a significant, you can see the reductions in HSCRP and the primary and the secondary outcome. You can see the separation of graft beautifully. But it disturbs the host defense mechanism. There is increased chance of fatal infections in the form of pneumonia or anything else, and the cost is high. So it is effective, but it carries certain threat. Then the second important trial they published on the effect of methotrexate as an anti-inflammation in a patient with CAD. And they had given 15 to 20 milligram of methotrexate in a multivessel CAD or a patient with a history of MI. But here again, the primary and there is no added benefit inspire and with a premature termination of trial required because of the seriously increase in the risk of cancer, leukopenia and all major adverse effect. So methotrexate is not at all recommended in a patient with CAD. Now the colchicine, it is a Greek and Egyptian molecules of bulbous of the carcass and it carries a very good anti-inflammatory property and there are 2-3 major trials has been published. The Colcott trial, it is in a patient with the ACS and they studied over a 2.3 years of a 4,000 population patients and they found it is having a significant effect in lowering the primary as well as the secondary outcome. The Lodoco 2, Lodoco and Lodoco MI is also going to publish. Here the low dose colchicine 0.5 milligram was studied and they found there is significant reductions not only the primary but also the secondary. You can see beautifully on the forest plot. The colchicine favors a better outcome compared to placebo. But the drawback of colchicine trial was the women population was less. The number of the selected cases, the volume was less and the biomarkers were not studied. So this is the summary of these 4 trials. The Lodoco, Cantos, CERT and CERT is a negative trial. But canakinumab and colchicine favors the outcome. But that canakinumab carries a serious threat. Even the colchicine has a, there are 30 patients, 30% of the population which have a serious GI side effect in the form of diarrhea and that required a lot of concerns. Even the tocilizumab has been studied, that is IL-6 receptor antagonist, but this tocilizumab has long-term prognosis is still needed. So anti-inflammatory, obviously there is a link of atherothrombosis, but the IL-1 beta monoclonal antibody, IL-6 receptor antagonist and the colchicines, they had proven some victory, but there are some still issues. The LDL side lowering in a patient with primary biliary cirrhosis, colchicine role has been established that it decreases the lipid level, but not in a routine patients. So there is a victory. I would like to end by this thing. There is a victory about anti-inflammatory therapy in a patient with coronary artery disease, but still long-term data are needed and for its safety and efficacy and the outcome. Thank you.